Hi. Pleomorphic adenoma of the parotid gland. That is the topic. Now, let me give you a small introduction so that you can understand better. Saliva, it's produced by the major salivary glands. We all have three sets of salivary glands. One is the parotid. Parotid gland is here, it's positioned here in the lower part of the ear. That is the largest of the three. So, you have one here and one here, one set, one pair. The second one being submandibular gland, just seen below the mandible. The third is sublingual gland, which is just below the tongue. So, we have three sets. In this salivary glands, you can have so many conditions which can affect the salivary gland. So, this picture shows you the three different types of major salivary glands. And you have so many hundreds, say about 1000 salivary glands in the small minor salivary glands in the oral cavity. So, I am talking about the major salivary glands. So, the salivary gland per se, it can be affected by so many different conditions. Maybe it can be congenital condition, or it may be trauma. All these can result in the gland swelling, or it can be trauma, or it can be infection, or it can be malignancy. When I say malignancy, it means if you leave the condition without any treatment, then it threatens your life. Something can happen to you. So, there is a condition called benign condition, means it is not infective, which can be easily removed with cured with an antibiotic. It is not like malignancy, which we have to take care immediately. So, benign condition is in between these two. You have to do surgery, maybe you can delay a bit, but if you do not do it and if you neglect it, maybe there is a chance it can turn malignant. That is what the word benign means. So, when it comes to the swelling of the salivary glands, we have classified into these types. In this, the pleomorphic adenoma stands the most commonest benign condition affecting the parotid gland. So, now you know what I mean by benign condition. So, now I am going to talk only about the condition, that is pleomorphic adenoma. So, pleomorphic adenoma is the most common benign salivary gland swelling, and it is more common in females, affecting the age group between 30 to 40. So, we have one more condition which is second common, which is Warthin's tumor, which is more common in males and affecting elderly age group, say after the age of 50 or 60. So, I am talking about pleomorphic adenoma, common in females and between the age group of 30 and 40. As you see in this picture, it is one-sided, and you can see the swelling here. This one you have in the lower part of the gland. So, it is in the lower part of the gland, the tail of the parotid, and it affects only one side. Why I say like that is, the other condition, the next common one, Warthin's tumor, it is usually seen on both sides, but this both sides bilaterality is seen only in 10 to 15%, not about pleomorphic adenoma. I am telling you about Warthin's. So, this condition, pleomorphic adenoma, is seen only on one side. Now, coming to the patient complaint. Patient says of late he has got a swelling in that particular area, that is below the ears, which is slowly growing and it is painless. So, when we examine the area, there is a swelling as he has mentioned, and the skin over the swelling is normal. That means there is no infective pathology, and to touch it is not warm, it is not painful also. That means there is no abscess, no infection. It is something else which we will come to. And the swelling is smooth, no pain, it is firm to touch, and the edges can be well defined. So, we have to come to a diagnosis. So, the investigations will be, to start with, I will do an ultrasound of the neck, that is enclosed to the parotid gland, and soon followed with fine needle aspiration cytology, where I will put in a small needle into the swelling and take out the cells and send it for histopathological examination, so we can get a definite diagnosis. So, these two investigations will be more than enough. So, if you ask me whether I will prefer an MRI or CT scan too, I will say MRI scan is better than CT scan. So, the other test, the ultrasound and FNAC will be more than enough. Suppose we have any doubt, we want to rule out other condition, if we can do a nuclear scan, it will come negative. So for completion's sake, we want to do a flexible laryngoscopy also. Why? Because this condition can affect the deeper part of the gland, parotid gland. In that case, there will be a swelling or irritation inside the mouth also, oral cavity also. So to rule out whether there is a swelling or not, we would like to do a flexible scopy. So now, if suppose we leave this condition and without treatment, we know it is benign and it is not going to immediately, it is not going to do any harm. Can we leave it like that? See, it is better that you get the treatment, get it done. Means better to do surgery. Why? Because there is a possibility that swelling can turn malignant. In early cases, the chance being 3 to 5%, and if you leave it like that, say for about 10 or 15 years, the chances of it turning malignant will be up to 10%. Not only that, even when you do a surgery, there is a possibility of recurrence. So these are the complications if you just leave it like that without giving attention to it. So this topic, pleomorphic adenoma, I am going to deal in 2 parts. This is the first part. Do watch the second part where I will tell you about the treatment. Thank you so much.